Back here in Israel, thousands of kilometers away, doctors are helping Ukrainian refugees as part of the groundbreaking virtual hospital of the Sheba Medical Center. Using technological solutions, mostly Israeli innovations, Israeli doctors are now able to provide those who manage to escape with the best medical care possible. And joining us now are two of those who spearhead this remarkable project, really. Dr. Gadi Segal, head of the internal telemedicine at Sheba, who has been treating himself refugees, and Dr. Galia Barkai, head of Sheba Beyond, Sheba's virtual hospital. Thank you very much for your time today. Professor Segal, I would like to start with you. The past few days must have been a whirlwind. That's perhaps an understatement. Tell us a bit about who you've been treating and a bit about the how before we dive into that further.
Well, I'm in constant contact with Sarit, which is our pioneering representative of Sheba Beyond at the border of Moldavia and Ukraine. Mm-hmm. And she went there with the technological instruments that enable me to both see, speak, and do most of the physical examination to the selected patients that need me. And you know that people are getting there with their chronic illnesses, mm-hmm. but currently being refugees, they don't have any access to their family physician or to primary medicine. So I've been asked about diabetic control and diabetic infections and skin rashes, and even general medicine issues that are affecting pregnant women and people that are in need for remote control or of their vitals. So
if I understand correctly, Dr. Segal, there's a liaison on the ground, Dr. Sarit, that you've mentioned, and she identifies or refugees who seek medical assistance are approaching her, and she's the one to connect between the two sides, correct?
Correct. She's joined the Ichud Hatzala group there, and she's our representative. And she's the connector, the connecting link, yes.
And Dr. Barkai, this is truly an extraordinary project that completely changes the possibilities when it comes to humanitarian aid. Tell us more about the technologies you're using.
So indeed, as Professor Segal said, we have a representative there, which is actually our CTO. So she brings technology there. And by the means of this technology, we can connect all our medical qualities of a tertiary medical center, Sheba Medical Center, to the field. So what she has with her are certain technologies that help us provide communication, of course, video communication and physical examination. That's the basis of this thing. So we use TytoCare, which allows us to listen to the heart and lungs of patients like a stethoscope, to see the throat and ears and see rashes. We use technology to do remote patient monitoring. So we use BioBeat, which is a technology that uses a kind of sticker that you put on your chest, and the clinician, Professor Segal, can see here in Israel, and also the clinicians there can see about 13 vital signs, including blood pressure, heart rate, oxygen saturation, etc. We also use technologies for remote care of pregnant women. We use a technology that allows us to do remote care ultrasound, and a physician here can see the ultrasound to see if we've seen their pregnant women, right. And other technologies as well. We intend to send her some more technologies that we're starting to use during the next days. For example, Healthy.io, which has a technology that allows us to monitor wounds by imaging. So we have all kinds of technologies that will help us provide the people in the field better knowledge to send here to Israel, to Sheba's specialists, can provide them with their expertise. This breaks all the borders.
And you've mentioned people on the field, and this takes me to my next question. Those technologies are essentially abolishing geographical limits to an extent, but does that replace humanitarian missions underground, or does that just, accompanies?
No, it's an additive thing. Of course, there's no change for people being there, but you can't send everyone there. And even if you send people there, you need to give them technologies, to give them extra knowledge. We have, by means now of technologies, ways to do on the spot, on the site, CBC, chemistry, blood tests, X-rays. So we can send portable machines to do things on the ground.
Right.
And the other thing is what I said before, is to connect the specialists to the people on the field, but it's not replacing the people on the field. It's just an additive value to these people.
And Professor Segal, before we go back to you, Dr. Barkai, one last question. This is perhaps one of the silver linings from the COVID pandemic period, right? The need to boost those mechanisms truly took center stage in the past 2 years.
Exactly. We believed in telemedicine and in remote care even before we saw the value of it. But really, the COVID pandemic allowed us to do things quicker, to accelerate the way we are experiencing technology, to know what works, what doesn't work. The motivation was a little bit different there. People didn't want to come to the hospital. And we wanted to do as much as we can without the need to bring people to the hospital. But yes, it allowed us to test many of these technologies we now know are working and give us a lot of value, definitely.
Professor Segal, I am sure that it's not just the physical state of refugees that is alarming or in need of care. I believe some of them were just eager to get some sense of confidence or reassurance or mental support, similarly to perhaps patients you meet on a daily basis as well. Tell us a bit about what you've been hearing or sensing from patients you've been in contact with.
I think there's no real difference between patients that are in the periphery of Israel that are using my services and refugees from the Ukraine. Each and every patient during acute illness or acute disease has a very big sense and need, as you said, for professional reassurance. And the conversation by itself has a healing potential, and you can hear someone that is thinking with you about the options that are viable, about the severity of the problem, about the prognosis, about the near future, about the far future, and of course that I'm trying to give these telemedicine patients the same service that I'm giving my in-hospital patients, comfort, and to give them hope. I think that the hope here is even more important because they are stressed by many issues rather than their physical condition.